Hello, my dog lovers. You're probably thinking that I lost my mind today. I haven't, because I have the most acclaimed and wonderful friend and colleague, Dr. Laurie McCauley here. She is a board certified exercise and rehabilitation specialist. And I'll explain why I have this attire and why I'm wearing double glasses. And I have these different devices like tuning fork and singing bowl and different machines from another planet. And I am so glad, Laurie, that you're here. Hi.
Hi, it's so awesome to be with you again. It's always so much
I'm so
fun.
excited. Oh my goodness. And I will take this off, you guys, in a moment. But before I do so, Laurie, I would like to thank you for taking me on this incredible journey of more than a year, maybe a year and a half, with my dog Pax, when we started healing him from his injuries after he got neutered and started having injuries that didn't heal. So you taught me, and the reason why I'm wearing this is that it's in a celebration of your knowledge and your guidance, because I started using laser machine some time ago. And together with mobility support and hormone replacement therapy, Pax just celebrated his weekend in Tofino, BC, which is actually the most important part of his life. Like, he just loves it there. And I may actually show you a little video of how he ran here. But the reason why I'm wearing these glasses is that laser treatment has to be used with glasses, protective glasses, and these are Pax's, so I'm going to take them off. And these are mine just to protect my eyes. But you guys, if you're looking for an effective, amazing method of restoring your dog's mobility and health, beside nutrition supplements and hormone replacement therapy, this is actually godsend. Like, I use it myself, and I'm so grateful, Laurie, that you not only have introduced me to this method and technique, amazing technique, but also that you have courses for everyone to actually learn how to be empowered and how to heal their dogs. And so I kind of thought I would celebrate you in this funny way and put on these
Oh,
glasses and all that stuff, because really, honestly, I can't really say how grateful I am and how much pleasure we've had last weekend to actually see Pax just going like crazy, having fun and being happy. And then the next day he would be a little tired, a little stiff, because we get stiff when we go crazy. And then the day after, like, I would do laser, I would do supplements, and I would do everything that I normally do. And he'd be ready to charge the next day again. And it's just so lovely to see. So today, the reason why we are here is that we'd like to talk about frequencies. And I know that you have been very passionate about using tuning forks for healing. And I will pretend today that I'm a golden retriever and I know very little about tuning forks. And I'm hoping that you'll be able to explain it to me and how to use it and explain it to our community. And then at the end, you guys don't run away, because we'll be answering some questions that you've asked through emails and inquiries. So, Laurie, it's all yours.
awesome.
You're in charge now.
Wonderful. So first of all, I've been, like you said, with the lasers, I've been teaching on lasers for literally at least 25 years. So I did some of the original research, and the lasers are just amazing. And, we hear people say, oh, why isn't it in the human medicine? And I do want to just point out there's so much research on it, and we use it in the veterinary medicine because insurance pays for it. And in human medicine, it doesn't. And there are actually clinics now that owned by laser companies, because the people will pay out of pocket, and they have higher quality of care with board certified human sports medicine people and orthopedics using laser. So yes, laser's been around for a long time, and I'm so glad it was able to help Pax. And having
And me, because I used to have a shoulder issue. Obviously, we lasered the whole family and wide circle of friends. So it's not just Pax, but everyone benefits, right? Our dogs teach us, and you
yeah,
obviously have. Yeah.
yeah, absolutely. And that is a great segue to the tuning fork, because I continue to learn because of my dogs. So the tuning fork I use is 128 hertz. It is a C. It is weighted, which means instead of, if the weights aren't on it, you would stimulate it and the vibration is more up here. When you have weights on it, it pulls the vibration down to the bottom. Mine I use with an amethyst crystal amplifier tip so that the energy comes through. And it's what's so cool is there's different tips, and the different stones have different energies and do different things in the body, which is like, I am so left-brained and right-brained. When I first heard that, I was like, yeah, right. It's a stone, right? Until I started using it. And you talked about our dogs teaching us lapis. So this is amethyst. Lapis lazuli is a blue stone that is really good for scar tissue. And when Sid had emergency abdominal surgery, thank God he didn't have a foreign object, but everything looked like he did. And his incision got infected, and then he had a ton of scar tissue. I used my tuning fork. I'm like, okay, it's good for scar tissue, and it helps some. And then I put the lapis tip on it, and it was like scary how fast the extra scar tissue went away. Like, I'm talking like not weeks or days or hours. I'm talking minutes of using the tuning fork on it, right? Stimulate it and then use it on the scar tissue. And it will, like, the body just gets rid of all the inflammation in it,
like
absorbs
resonates with it. Yeah, yeah.
Exactly. It resonates with it. So yeah, our dogs teach us so much.
I really love the principle of vibration, because if you think of every single particle in our body, they vibrate at a certain frequency, right? And I find disease, or at least I see disease as disturbance in these frequencies. And when we introduce a frequency that is aligned with health, then actually it can reset, revibrate the particles to the right frequency, right? So that's how the body resets. That's how I understand it. But remember, I'm a golden retriever, and I need more explanation about that. So tell me, how did this come up? Like this whole principle of healing with energies. And I know that we don't know what we don't know. So I really try to be open, and I encourage everyone else who's listening and watching to be open, because we may miss something that is really life-giving and extending our dogs' lives and our lives. So I'm all ears and eyes, and I want to hear all about it.
So I learned about fascia from Patrice Corticus, who's a human osteopath who's in Eugene, Oregon. And she teaches a course a couple times a year. She also teaches in Europe. In case you ever want to, while you're in Europe, go to where she's teaching there. I think it's Finland and Denmark. Amazingly talented lady. And she taught us about the tuning forks and fascia. And 128 hertz is the frequency of fascia. And I took, because of who I am, I push boundaries and learn. I took everything she teaches and then says, what else can I do? Right?
So exciting.
Like, it's so exciting.
So exciting.
So let's talk about fascia first. So if people think about, like, you eat a steak and there's like this shiny stuff, that's coarse fascia, right? Or dense fascia. And then if you were like to have chicken, what is attaching the skin to the meat is soft fascia. So there's different kinds of fascia, but it is literally one big plane in the body. So every piece of fascia is attached to every other piece.
Interconnected. And Pax is saying yes. He's saying yes. He agrees.
When they did electron microscopy, so looking like tiny, tiny, tiny pieces, they found that not only does the fascia go over the muscle, but it goes around every muscle cell and around every nerve, every lymph vessel, but it goes into the nucleus, right? Where all the DNA is made and the ATP and energy of every cell in the body.
Somehow it's connected with the cell and everything. So it's almost like maybe that's the first, not World Wide Web, but body wide web.
Yes.
Tissue, basically. It's absolutely like interconnected. Like the body is an electric system and a frequency system, right? So we agree on that. Yeah. Wow. That's amazing.
So there's studies that look at, like, I do acupuncture, right? So there's studies that look at how one of the ways that acupuncture works is when you stick the needle through the tissue and twist it, you're actually wrapping the fascia around the body, which is why we can have a different effect if we go clockwise versus counterclockwise.
Oh, that's another one. Wow. How come it's different? Do you know? Does anyone know?
Well, in traditional Chinese medicine, They say that if you spin the needle clockwise, you're stimulating the point. And if you turn it counterclockwise, you're sedating the point. So both ways you're having an effect on the acupuncture point, but you're doing two different things with it. So when we have scar tissue or things like inactivity, right? Dehydration, all of those things take these little strands that look like spider webs, which are fibrin, right? That have hyaluronic acid
Elastin,
around it.
fibrin, elastin,
Yep.
like all those together. Yes, yes.
Yep.
They're
And it
long
looks like
fibers, right? They're very long. They're not just small little cells. They're long cells, if I remember well from histology many years back.
Yeah. And it's what connects all the tissue. And when you are inactive, when you're dehydrated, when you have scar tissue, when you have less blood flow, it gets what I call sticky icky. So literally the tissue sticks together and they have,
Congested, like
Yeah.
little glue.
and actually fat can get in there.
I see. I see.
Fat can get in there and it literally gets like thick and gooey and then things don't slide. And then it contracts, right? So if it's around every blood vessel and it contracts, it decreases blood flow more. If it's around the lymph system and you have swelling and it contracts, you can't have that fluid that comes through. And so you have swelling. There's actually even studies that show that if you have cancer, if your fascia is fluid, right, not sticky icky, you have less metastasis, which to me is like, wow, why aren't we doing studies on fixing the fascia in our cancer patients so that they don't have metastasis, which is going to shorten their life expectancy?
I'm so glad that you're mentioning this because I've always believed that when there is stuckness in the body, energy flow decrease or congestion, or as you say, gooey, wooey, those areas are usually more prone to tumor formation, whether it's benign lumps, lipomas, and so on, or more malignant cancers. And I've definitely seen that. If I would have sometimes patients where I would examine their spine and I would touch a certain point, let's say lung point. And if the dog would really react, I would take them right directly to the X-ray because I would know that there is a severe pathology, right? So there's a way of reading the body, and I'm sure as you as an acupuncturist and an amazing practitioner, you probably have many more other ways of checking if there is something wrong. So I'm sure that people will be interested, at least in the course of this recording, to learn more about that as well, how you see it and how they can actually examine and assess their dog.
Absolutely. So we can talk for a second about using the tuning fork as a diagnostic tool, finding problems, as well as a therapeutic tool, fixing problems. So if we activate the tuning fork and you were to
just
go
for
down,
everyone, I have a tuning fork that is not the same frequency. You can see that it's longer. It doesn't have the stone. And I just found it because I used to use it in my yoga classes. And this morning, I discovered it. I go, I have to use it, at least pretend. So
yeah. So it's not as easy with that because you don't have the tip. But if you take the tuning fork and you activate it and then you slide it in an area where there is no restrictions, it'll slide right down. Right?
Let's
And then
just
if
see
you
if
pick
it
an
really
area-
works.
Right? So now what I want you to do, Peter, is do it on your neck or somewhere where you have maybe like
I
your
had a
neck is
surgery
bothering
in
you.
my.
And you
I can
slide it,
definitely feel it.
it's not a drag, right?
Yeah. It's a
That
drag.
tells you, yeah, isn't that cool? That tells you that you have a fascial restriction in there. And so many of us are
Definitely
looking at,
do still. Yes.
yeah, whether we're looking at our phone, on our computer, in the vet clinics doing surgery or looking down at our patients, we frequently have neck issues. So I literally drive with this in my car. So when I'm at a stoplight, I can be like, oh yeah, oh, that feels really good.
Okay.
Right?
Okay. Wonderful.
So let's take it to one step further. So many of us are on our computer or on our phone and we get trigger points, right? So if you take one of your hands and reach up to your traps, can you find a trigger point?
Yeah. I got it.
Okay.
Yeah.
So now you're going to take your tuning fork and put it right on that trigger point. So stimulate it. And again, I don't know if that's going to work because it's not the
It's a
128.
different frequency, right? Now we're doing an experiment in the middle of the broadcast or recording.
That's good. That's live. That's real. See, I can do
It feels
that.
good. No matter what, it does feel good.
What you'll find on a trigger point is that, like, if I stimulate it and just put it on my hand where I have no problems, it'll vibrate for a good 30, 40 seconds. If I put it on an area, whether it be the trigger point or fascial restrictions in my neck, it'll dampen or stop vibrating much faster.
It almost like it uses up the frequency because it
Mhm.
needs it, right? So it just
Yes.
it's like a syringe, and if you don't need the medicine, it just goes slower. And if you need it, then the syringe just empties really fast.
Yeah.
Okay.
So like I did that and my trigger point is gone. 100% gone. So
Mine is definitely better, I must say.
Mhm.
Yeah. So, it's very possible. It would be interesting to try different frequencies and for different areas, right, as well. Have there been any studies?
So again, from Patrice, and there's some schools that teach using the tuning forks for humans. They say that one frequency is for bone, one is for organs, and then the 128 is for fascia. And forgive me, I don't remember which is which, but the 64 and the 256, one is bone and one is organs. So you have the
Okay.
most effect.
Okay.
So like I can use the tuning fork and release my diaphragm so I can breathe better. Right. So think about like all the dog athletes and stuff. If they can breathe better, they can run better. They can perform better.
I love that we're adding different tools in the toolkit of dog lovers and really making you guys empowered, because there's nothing more fun than actually sitting down with you, learning from me, and also being able to pass the information on to others, because obviously I don't know everything. And I think that the most important part is that we're open to knowing what we don't know. We don't know what we don't know. And if we close our minds and say, oh, this doesn't work, or this is too crazy, far out, then we may miss something that is really important. And so tuning fork, really, definitely, I'll be getting the exact frequency that you have, and I'll be reporting back. Let's look at some practical applications of using the tuning forks. Like we talked about the congestion of the points. And is there anything else that we can do, especially if animals are, I don't know, if they have organ disease, or if they have, let's say, certain injuries like cruciate ligament tear or post-surgical recovery, whatever else you can think of and you can share, I'd be very grateful.
Absolutely. And when I go to conferences, and I've been to some like agility, like the internationals and stuff like that, shows, I'm always trying to teach and learn. So I've worked with people as well as animals. Not that I'm a human doctor yet. I always want to play.
Yes.
And I can tell you,
I can imagine that he'd be going to medical school now, but maybe there is.
I'm way too old for that. Way too old for that. But I can tell you, like, I had a person who is a high-end competitor. I won't give a name because I don't have their permission, who hurt their knee, and they just wasn't perfect, right? And this is high-end or very competitive, like the top dogs in the world are there. And what we did was we said, okay, well, you have restricted motion. So obviously there's scar tissue, there's fascial restrictions. So we worked around her knee, and literally in, I'd say maybe 7 to 10 minutes, maybe 12 minutes, she could move her knee more. Her pain was gone, and she had better range of motion and freedom with her knee, which was crazy, right? To
So
think
this
that
is much better than ibuprofen or NSAIDs without the side effects. And
Right.
when we add everything else, omegas, mobility support, and laser and tuning forks, like, why do we need drugs? Like, I'm still asking, why do we need drugs when we can manage without them most of the time by not only using the therapies, but also strengthening? And that's the other thing that I find is super important, and you may have an opinion about. What do you think about strengthening? Derailing a little bit, but not quite.
No, that's perfect, because that's exactly what I told this person. was, okay, we've loosened up the scar tissue, but now your body has to get used to it, right? So now you move more. So your nerves have to know where you are in space. So you need to get into different positions while you're weight bearing so that the messages from your knee go up to your brain so that you don't twist it or anything else. And now the scar tissue that was some stability, inappropriate stability, but stability is gone. So now we have to strengthen the muscles, tendons, and ligaments, which are much, much, much stronger to help support that knee so that you don't get injured, right? So stability is super, super important. And even something as simple for a human as standing on one leg and just working on your balance works on your proprioception, so your balance, your nervous system, and then all the stabilizers, so muscles, tendons, and ligaments that are supporting that knee to help, again, prevent injury and increase balance, proprioception, and strength.
I feel often really frustrated to hear people saying that they were told that they should not exercise their dogs at all, or they should slow down, or your dog is old, you have to slow down. And what I've noticed, because I could be called an old dog too, I'm 61. What I've noticed that if I strengthen and if I really work on exercising and lifting and making sure that I actually do weights, that it is actually at this point of my life more important than being over flexible and doing more yoga. So I kind of transitioned from yoga to more strengthening and notice a huge difference in how injury resistant I am and how much better I feel when I'm walking. And then I'm seeing older dogs, older people just kind of hobbling around. And I feel so sad because I know that there's a solution. If only we have taught dog lovers to make sure that their dogs exercise, right? And that their dogs strengthen the right way. So do you have any courses on that, or do you have, I'm sure that you do. How do you keep a middle-aged dog mobile into the senior years?
So I have to say I am a huge learner as well as teacher. And Peter Attia, one of the Stanford doctors, I adore his podcasts.
Who wouldn't, right? Like, he's amazing.
He's amazing. Brilliant.
He's a nerd. Brilliant. So good, and so much at service of others. I love him too.
And one of the things he talks about with exercise is for humans, there's a ton of proof that shows that you live longer and have a longer health span. So how good you feel as you get old with 3 different kinds of exercises. So you need proprioception and balance exercises. So that for a human would be like dancing or Zumba or something where Tai Chi, right? Any yoga, that kind of thing that's working on your balance. You need strength with weights. And then you need endurance. So you're walking, running,
cardio.
swimming.
Yes.
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 So we are going to do that with the dogs as well, right? We need our walking, running, swimming. We need our strength exercises. And though we don't have weights for dogs, we can shift their weight. Things like putting their front feet up on something while they're doing an exercise to increase weight to the joints so that we can keep them healthy and stronger. So we have our endurance, our weights, and then our proprioception and balance. So like stepping over things and making them think with both their brain and their body to work on the nervous system. So we have our cardiac system, right, with our endurance and muscles. We have our strength, and then we have our nervous system. And yes, I do. I happen to have a course called Core and More, Foundational Exercises for Your Dogs, which is 24 exercises that covers all of that. So it is a 6-week program. So you don't get all the exercises at once because there's too many people that are type A personality and they want to start with the hardest thing. So we make it progressive so that you start with the easiest and then you learn 4 exercises every 2 weeks. And then you have a year to do it so you can take your time with your dog, get them comfortable. We give you beginning points and end points. Teach biomechanics for the human because you're not going to help your dog if you're hurt your back. I think how the dogs are going to cheat because I've been teaching exercises since 1998. How they cheat, how to outthink them, biomechanics, red flags. So if your dog does blank, then you need to stop what you're doing and take him to the vet because that's a sign that something could be wrong. These are the only 24 exercises you ever do. Your dog will be stronger and live longer. and have a better health.
Now, I know that most of our colleagues are well-intended, but I also see the tendency to offer anti-inflammatories, maybe some joint supplements and omegas, but very little rehabilitation, very little strengthening, very little education on that level. If people have a veterinarian who is either not aware of these methods or unopen to these methods, what do you suggest? Like, do you suggest people to seek help from someone else, or do you suggest that they talk to their veterinarian and say, hey, there is Dr. Laurie McCauley's materials, or what do you do? Do you teach veterinarians as well?
I do. So I have a exercise course for the veterinarians called Optimum Geriatric Exercise, which is the same exercises. They're like sister programs. The pet parent one is just simplified, so it doesn't have as much information, but it's an excellent course.
The weird words that nobody understands, right?
Right. Yep. But yeah, I for me, I would love for the veterinarians to take the exercise course, because it's literally the only 24 exercises they would ever need to be able to give to their patients. And that would be from a 16-week-old puppy to an adult to an athlete to a 16-year-old dog.
So everyone who's listening, and maybe there are some veterinarians listening, please spread this information. Make sure that everyone knows about Dr. Laurie McCauley, because as you can see, oh my goodness, like, you're such a gift to the dog lover world, and dogs, obviously.
Thank you.
So I know that we wanted to answer some questions as well from the community. I got some questions here. And the first question is, how to recognize joint issues and pain?
Great question.
Good one, right? Thank you so much.
Yeah. Because a lot of times you're not going to see a lameness until it's really bad, right? Because the dogs are going to hide it.
Almost too late, right?
Right.
It's
So
not
it
too
could
late,
be anything.
but later than optimal. Let's put it this way.
I always try to find problems when they're baby problems and fix them, that rather than waiting until they're really big problems, and then it makes it harder to fix. And then you may need to have the drugs or whatever else you need. So my thought would be, first get used to your dog's body. And I just happen to have, you can see Magic's foot. He's laying behind me. But get used to your dog's body. Get them used to you touching them. So whether it be looking at their foot and putting your fingers on either side of their toes. Literally just 2 weeks ago, Sid broke a nail, and I didn't know it. He wasn't lame, but I touched his foot and he screamed. I'm like, uh-oh, what's going on? And he had cracked a nail, and every time he stepped, it was uncomfortable for him. Every time you touched it, it was like us having a hangnail. And when you're used to touching your dog, you find those things. Thank God it didn't get infected or have any problems. So we took the extra piece off. We got him on collagen so that his nails would grow back faster. And within a week, he was doing great. But get used to touching your dog. Let's see if you can see this. Right? Bend. How much can I bend? How much can I straighten?
I'm seeing only the leg. No dog. That's okay. Oh, my goodness. I don't really know where Pakshi is. He could say hi, but I'll just... she's so sweet. Oh, my goodness.
Yeah, she just turned a year old, and she's a big lug. I love her to pieces.
You have 2 dogs, right?
Yes. Sid is turning 8 in June.
Yeah. I see Sid often in our sessions. He's a great demo dog as well.
Yep. So checking feet, bending their wrists, bending their elbows. If you go to bend the elbow and they're like, I don't want to do it, probably something in the elbow. Flexing the shoulders, not as big of a deal. That's very rarely uncomfortable. Extending their arm all the way out. If you have your dog laying down and their back is totally straight and their head is at a 90-degree angle, right? So their nose is pointing down. Every dog, every breed should be able to take their front leg and come right up to their eye. Every dog, every breed should be able to take their front leg and either point to or touch their knee. Every dog, every breed, if their back is straight, their back has to be straight, should be able to take their back leg and their toes should either point to or touch their knee. Touch your elbow.
Even Daxies?
Yeah, well, they point to. It's in your legs. They can point to it.
Like,
it's right there. It's up there.
I can't do it.
And then I say, put your hand on their pelvis and take their back leg back and get used to what your dog's normal is. And if it doesn't go as in any direction, there's some kind of restriction. And if they pull against you repeatedly and you're doing it nice and slow, it hurts.
Yes. Yes. Okay. That's how I know that when a dog turns back, or when they kind of flinch, or they don't like it, or sometimes they may actually scratch the area, or they may roll on the back, right? That, people think that their back is itchy, but they're trying to, or lick their extremities and paws. Sometimes it can be muscle pain. Sometimes it can be neuropathy or something like that. When they have collar injuries, especially, I see that a lot, especially with the retractable leashes, because dogs run and then they run to the end of the leash and they get a really bad adjustment. So dogs actually are quite smart pointing to those areas. We just need to learn how to read the language, right? Like how to read what they're saying. Yeah, that's really lovely. Thank you. So we talked about pain. And we kind of started talking about this as well. Like another question is how to prevent muscle loss. And that's relatively simple and clear, but maybe you can go through the steps of how to prevent muscle loss.
Exercise, nutrition. There's some supplements out there like Myos that actually stop what we call myostatin. So myo means muscle, statin means stop, right? So people think about like blood pressure medications and they take statins. If you get injured or as you get older, your body produces more myostatin, which stops you from being able to create new muscle or get stronger. So you can't just take a supplement, right? Without the exercise, it's not going to do anything. But by taking the supplement, it allows you to get rid of the myostatin so that you can build muscle and build it faster.
How about creatine? I take creatine with my protein powders. What do you think of that? Is it used in dogs?
It's not used as much in dogs. There's not as much studies in dogs. But definitely in humans, absolutely, it can help you build. Again, I was just listening to Peter Attia yesterday, and he was talking about that in humans, they use
he suggests quite a bit. So I believe that humans get about 3 to 5 milligrams total of creatine.
Yes.
Dogs, protein, super important, right? Like if you put them on low protein diet when they age, and I write about it repeatedly and talk about it repeatedly. We cannot really put our dogs on a low protein diet when they're aging because we starve them. I actually just saw a dog in Tofino in Long Beach, British Columbia, and the poor dog was 14 years, completely muscle wasted, probably on low protein food. And what I've seen from my clinical experience that even when dogs have, let's say, elevated liver enzymes or kidney issues, that they do much better on high quality protein diet for long extended period of time than low protein diets. I would see them just kind of deteriorating so quickly. What is your opinion about that?
I think protein's huge. Again, there's tons and tons of research in humans. And I agree with you 100% that it's not just the amount of protein, it's the quality of the protein. And I can tell you there's studies in dogs that show that if you do a calorie restriction versus calorie restriction with exercise, the dogs that are just on calorie restriction lose almost as much muscle mass as they do fat.
Yes.
And the dogs that are on the exercise and calorie restriction maintain or build muscle as they lose significantly more fat.
And you can be more correct because I know that people try to lose weight. When we hit 40, we all try to kind of maintain our weight. People think that hopping on the scale and seeing the pounds or kilograms going down is important, but it's actually about maintaining the metabolic function of the muscles because they help us to restore and also lose weight and burn fat and energy. But if we lose weight the traditional, conventional way, we usually lose muscle, as you say, and the same happens in dogs, right? Yeah. So, I've noticed, and this is actually something really striking and really interesting. I now recognize a neuter dog versus a neuter dog because they actually have this kind of almost like a doughy quality to their body. They have maybe more congestion in the fascia and so on, and the stickiness. When they're put on HRT, when they're put on hormones, if they're neutered or spayed, suddenly they just kind of slim down and the body performs better. They gain more muscle and they lose weight. And I think that happens to us as the hormonal health that kind of declines in our age. As we age, we start gaining weight even though we eat less or we exercise more. So again, there's the combination of the different pieces of the puzzle, put them all together, and we have good health and longevity. So it's quite something. I hear people, whether it's about their dogs or themselves, is saying, my dog was fine or was fine, and then I slipped and my ACL or cruciate ligament tore. Like, is that just sudden, or is it gradual process that ends up with this tipping point of suddenly it tears?
That's it exactly. So it's cruciate disease. So when I graduated vet school in 1992, so a very, very long time ago, we would see an occasional cruciate tear, and it was a dog that jumped up to catch a frisbee, came down wrong, twisted. You had that rotation at the knee, and they tore the cruciate. Nowadays, what it is a chronic inflammation. So cruciate disease is from here to here, but the tear is here, right? So you have inflammation in the knee, and then the ligament itself is made up of fibers. And then you pop, 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 tear.
It's like a shoelace that kind of gets frayed and gets weaker and weaker until it tears.
Yeah.
Hopefully not a bungee cord.
And they show that, a lot of dogs may be running across the yard and they scream and they pick up their knee, but that's that last little bit tearing, right? It's not the very beginning. And if we can isolate when there's inflammation starting and stop it, and laser is one of those things that we can use to stop the inflammation, we can hopefully prevent it, because cruciate is so important and so big right now. It is literally, depending upon the surgeon, over 50% of the orthopedic surgeries that surgeons do right now is cruciate surgery. And up to 50% of the dogs need a second one within 2 years.
And this is actually another important part of or piece of the puzzle. Dr. Michelle Kutzler, who's done research in hormone-sparing sterilization and hormone replacement therapy, discovered that when dogs are spayed and neutered, luteinizing hormone goes through the roof, and it creates inflammation in the body. It actually attaches to the ligament tissue and so on. She found the complexes, and she discovered that when dogs are not neutered or spayed the conventional way, if we either do vasectomy or very sparing space, that the cruciate ligament tears are actually much less frequent. So everyone, if you want to read about this, you can go to hormonehealthfordogs.com or parsemusfoundation.com. I'll put the names right here. You can find more about this, because this is super important. And if you have a dog that has had one cruciate ligament tear or even both, HRT is, in my opinion, one of the most important parts of recovery and treatment, because without those, your dog will not be able to regenerate muscles and get stronger. So thank you for kind of bringing us the full circle to the ligament tears and everything else. I have a suggestion.
What's that?
I'd like to play a little game, or not a game, but back and forth. I know that most people say, so if I have a young dog, what can I do to make my dog mobile and healthy and arthritis free for as long as possible? How can I have as many summers as possible with my dog? Mm-hmm. So why don't we just go back and forth, and you say one thing that is important and I'll say one thing, and then we'll go back and forth and see how far we get. I think that you'll probably have more things to say, maybe. I don't know. And if so, I will learn something. It's amazing. So why don't we just start with you?
Obesity. Purina did a study that took dogs that were pet weight, so not obese, pet weight, and then restricted calories, 25% for the other half of the litter. So genetically very, very similar. And the dogs that were lean, not just normal, but lean, lived an average of 2 years longer. 2 years! With a lot less arthritis and metabolic disease.
It's incredible. It's 10 to 20% of the lifespan, right? Just by that.
Yep.
Non-processed food, definitely. Yes. Healthy, wholesome ingredients that are not processed. No fillers, preservatives, ingredients that don't belong in food. So that's my contribution. Back to you.
Exercise, right? Will help your dog live longer, less likely to have arthritis. Exercise. Actually, the Canadian Physicians College put out a statement probably a decade ago that said exercise was a highly underutilized and appropriate form of pain control for arthritis in humans. we should be doing the same kind of exercises with our dogs to not, so we don't have to use the drugs that can hurt the kidney and the liver and all of that, but to strengthen the dogs and decrease pain to help them live longer.
And so when there's weakness, there is instability of joint and tissue, and the tissue gets weaker as well. So it just kind of, it just starts basically putting more stress on the joints, right? And that's what happens.
Yep. Most people think about exercise as strengthening their muscles, which it does. So within 3 to 4 weeks of starting an exercise program, you have physiologic change in the muscles that make you stronger, changes in the chemicals in the cells and all of that. But within 3 to 4 months of exercise, you can strengthen the tendons and ligaments, right? So not only are we strengthening the muscles to help support the tendons and ligaments that support the joints, but we can strengthen them specifically. And conversely, inactivity atrophies or weakens them besides age.
So unless you live in the North Pole and you have minus 50 Celsius or something, and even then, you probably should and need to find actually a way of exercising, whether it's on a treadmill or you have a swimming pool or something like that. But I find that people need to actually put exercise and dog walks in their calendar, set it off. Like I have basically, my team knows that I start early and then there's block off, and there is no one who's going to book anything in that block of time for Pax and I. And we go and we hike in the hills here and do all sorts of different stuff. So if you have a dog, it's the best longevity plan, number one, right? We know that here, Laurie and I. And most dog lovers who are watching, they know that. And for those of you who are having a hard time to fit it in, or just let your dog in the garden or in the yard, just make sure that you actually go out and hike and walk and do the exercise. I am a little less of a fan of people going to a dog park, yapping around. Their dogs are doing whatever they want to do. Sometimes they get injured or throw the ball and talking, right? Like that doesn't really help us. It may help your dog or may not, depending, how healthy the exercise is. But overall, let's, put it in the schedule and go out in the hills, ideally. And if you live in a flatland, somewhere flatlands, then maybe a little bit of jogging, healthy jogging would be probably good too. How much jogging can dogs do? And can people bike with dogs?
We study muscle fibers. And you have type A muscle fibers, which are your endurance and your postural muscle fibers. And it's important to know that those are our endurance. So they're small, they're thin, but they can go for a long time, right? So your marathon runners, right? Those are the people who are lean, but they can run for 20 miles, right? Then you have your gym rats, which have more type 2 muscle fibers, they're big and thick. They're really powerful, but they fatigue quickly. And then you have your fibers that have some of both properties. And with dogs, we have type 1, we have type 2, we have type 2B, type 2C, type 2 dog, if I remember correctly. And that's what makes dogs able to do like the Iditarod. When, a few days traverse 1,000 miles. They don't build up lactic acid like humans do. They get to pyruvate. And when they start running hard, their lactic acid jumps up and then it comes right back down. So yes, they can when it's age appropriate, right? You can't take a 6-month-old dog and go for a 10-mile run, just like you wouldn't take a 3-year-old human and take them for a 10-mile run.
I used to live in a ski resort, Whistler, BC, and worked there as a vet. And we had a lot of injuries because people would take dogs and they would bike with them. So I am not a huge proponent of biking with dogs, unless it's really, really slow, because I think that they just tried so hard not to lose us that they sometimes overexert themselves. Is that how you see it, or what is your opinion about that?
So I think it needs to be done appropriately if you're going to do it. I just recently saw somebody riding their bike and their dog was off leash about 3 feet away from them on the side. And it was beautiful. They were tandem together. They were perfectly tied. Now, if your dog is attached to you or attached to the bike and you fall, the last thing I want somebody to do is fall on their dog, or their dog to turn, hey, squirrel, and get run over by the bike, right? So there's got to be an appropriate relationship and communication so that it's done correctly if you're going to do it.
And, I have a feeling that maybe in your area, the bikers are a little tamer. Here in British Columbia, they would hurl themselves down the hill 50 miles an hour. And yeah, it's a different intensity. So once again, you guys, I think that the most important part is to make sure that your dog doesn't get injured, that you're mindful, and that probably running and walking is much more suitable in general because it's safer. Omega oils, omega 3s. I am on 3 grams of omega 3s per day. I take them religiously because I noticed that since I started taking them, not only I am still functioning on the brain level, I'm also mobile. And unlike my friends, I'm actually not complaining about joints. They're good for, EPA is good for anti-inflammatory effect based on research, as Laurie may probably tell us more about. And also it is important for cell regeneration. If you're choosing omegas, make sure that you choose low mercury, sustainable source. I love squid or calamari because it's low on the food chain. And, I'm so grateful for omegas, actually. They're just, for years, early in my practice years, I didn't really acknowledge, and I feel so bad. I didn't acknowledge how important they were. And nobody, we kind of learned that they were good for skin, but nobody told us how miraculous they are and how important they are. So I always go a little extra, especially, when Pax exercises sort of goes crazy at the beach. I actually double his dose for that evening just to kind of improve the recovery. And his recovery rate really blows me away because I would never expect a dog that would run like crazy one day at the beach would just kind of shake off, and 12 hours later he's able to do that again without any problems. I would expect them to be stiff and expect them to be affected by it. He may slow down a little bit, but the recovery rate is so much faster with omegas than without them. That's my experience.
I agree 100%. I'm on 2 grams of omega 3s every day. I think they're amazing. I can tell you it is the most researched, most positive research supplement out there in the dog world. So, and a huge amount of research in the human world as well.
I have a kind of emotional connection with omegas as well. When I went to source, it took me about 2 years to source the right omega oils. And I discovered this amazing family-based company in Norway. And I flew there and I went through the facility and was just like so thrilled and impressed. You could virtually eat from the floor because it was so clean and so amazing. And the lab was really top notch and they were testing for heavy metals and so on. So we've been working with them since, and we make Feel Good Omega. But the moment I arrived in Norway, I learned about my dog Sky, that he was actually on his last leg, and I had to fly back. And I wish he was alive now, because I would not only have amazing omega for him, but I would also have hormone replacement therapy. I would have laser. I would have tuning forks and all that stuff. I wrote this letter to him when I was flying back, cried the whole time back. And then I had to do the most important and the most difficult part. And it was just really hard. But yeah, every time I think of Feel Good Omega and the trip, I feel him. I think of him. So anyway, I try to escape the emotional part a little bit.
I'm sorry.
It's hard for me to go back there. And I did, but
I think what is, one, very touching that you share that, right? I think that's really important for your audience to know that as veterinarians, it's not part of our day-to-day thing, and it's hard every time we take away their pain and let them pass in peace. And it's super duper hard when it's our own pet, because we all feel imposter syndrome and think, why don't I know more? Why can't I do more? What's wrong with me that I don't, right? And it's not. We do, as veterinarians, we do everything we can to help them as much as we can. And then I teach my students, my interns, we have to remember we have DBM after our name, not GOD. And we can help them have good quality of life while they're with us.
yeah.
And then help them pass peacefully. But we can't make them live forever. I honor you for being vulnerable and sharing that. Thank you.
Thank you. Yeah, we're dog lovers. We're vets, but we're dog lovers. And you're absolutely right. Like when we can't figure something, whether it's for our patients or dogs, we feel like we failed. But I think that it's normal not knowing. And the only thing that we can do is actually to continue learning and continue being open-minded. And as I said, like I tell my team, when I stop learning and when I start being rigid and flexible about learning, just please get rid of me. Just
Right.
fire
Shoot.
me. So what's next?
All
We've
right.
been going through this
What's next?
list and we're having so much fun.
Teaching, whether it be spin and twirl or crawling or not just the exercises, but to work the dog's brain. So again, I'm
Hmm.
research based, right? And there's studies that show even in terminal humans that if you are learning something, you're creating new neurons in your brain. So your endurance exercise actually increases the life expectancy of each neuron. And when you learn something, you get new neurons. And we see so much more cognitive dysfunction, right? Senility in dogs than we used to, whether it be because they're living longer or because of the processed foods or whatever else is causing it. By continuing to teach your dog new things, you're stimulating their brain so that they're not going to be looking at the wrong end of the door or talking at night or pacing back and forth because they
Or
just don't know
bored,
where they
just simply bored. Simply bored. And, I think that dogs can get depressed when they don't have enough
Yes.
activity. And, I would encourage everyone to kind of create situations and setups where dogs would have aunties and uncles to go to when people go to work, hang out with senior people who can have a dog or don't have a dog, and they would love to hang out. And I think that there are so many ways, and plus exercises. And my team member, Robin, she's amazing. She's a dog lover extraordinaire, and you know her. She calls it enrichment. She always says, we have to talk about enrichment. And so, yeah, I'm actually learning from her about enrichment. And sometimes I do feel actually a little guilty about Pax not having, like, Pax has an amazing life. Like, we really prioritize him in many ways. But I do feel that I get busy and I don't have as much time or even energy to actually do these little games and so on. Do you have any programs on that, or are you planning to do programs on enrichment?
So Corin Moore teaches the 24 exercises, right? So we have that. I do have to tell you with enrichment, I am so into enrichment. We got baby chickens, right? So they were 1 day old and they live in my bathroom, right? And my guest bathroom is now taken over with 9 baby chicks. But we have all kinds of things in there with the idea that when they go out to outside, we have a coop and a fenced in area. And then when they're old enough, they'll have access to the 5.5 acres. But they have to be strong enough to go from the floor to the brooding boxes up to the perches, which are like 4 and 5 feet high. So I have baby chickens going all over my bathroom, and there's toys and there's things for them to climb on and to grab onto. Enrichment to me is
Nice.
so important.
Nice. Mobility support. I know that providing the building blocks for our joints is
Huge.
super important. I like to kind of see mobility supplements as the ingredients. Like, nobody expects for tomatoes to grow without fertilizers that are organic, of course, or the building blocks. And our bodies and our food is now not really functioning, or we're not living in an environment that is actually as it used to be. So we are not getting all the nutrients. We are not getting all the wholesomeness of food that it used to be. So providing good building blocks, whether they're for cartilage and joints and muscles. I took the longest time actually to create joint butter because and joint powder. We now call it joint powder because we turned it into powder for dogs and joint butter for humans. But I took the longest time because I felt like it has to be really effective and good. And my general sense is that there is a lot of supplements that are made in China. Sometimes they're measured and tested and the ingredients are not there. So, I really believe that people should not be cheaping out on mobility support, that they should get support that is ideally made of natural ingredients as much as possible. Fermentation increases the bioavailability by 7 to 10 times. So that's another really important part. And test different products and see. I am very happy and kind of surprised that people report so many good results with joint powder. I can only say that we just have to keep learning and have to keep improving things. But joint support and mobility, especially in dogs that are middle-aged and older, again, I only suggest what I do for Pax and myself. And, some people say, oh, Peter, you're just selling supplements and so on. And my reply usually is like, what do you want me to do? Like, do you want me to just tell you there's a problem and not provide a solution? It just doesn't really feel right. So, I try to provide as much information as I can for free or inexpensively. But when it comes to good supplements, like there is a difference between cheap product made in China and product that is really wholesome and made of the right ingredients and pure clean ingredients. So it's cheaper than drugs most of the time. But anyway, that's my little rant on supplementation, because I used to be very kind of like blasé about supplements in the early days of my practice. And then I realized that they make more difference than I ever imagined. So I'm really passionate about it. I have my own little cup that has about 20 different capsules every day from minerals to probiotics and mobility and liver cleanse and omegas and so on. But I feel better than most of my classmates and people that I see in my age. So I go, okay, even though I don't know everything, I think it's important for us to acknowledge the importance of nutrition and see them as concentrated nutrients as opposed to pills. Because people say, oh, I don't want to take pills, or I don't want to give my dog so much. But it does seem to make a difference. And it's humbling, really. It's humbling how much we have to learn. And with AI now, we will probably be learning so much more. I'm hoping that we'll still live to the time when all the health problems will be solved, right? And our dogs will live suddenly like 30 years as opposed to 15, right. Or, it would be so much fun.
Well, I have to agree 100% with you on the mobility and the supplements. I too take like 20 pills a day, and I love when I go to a doctor and they say, who's your pharmacist? And I say, I don't have one, right? The way I tell people is you pay now or you pay later. You pay now with supplements and you get healthy, or you pay later with drugs and you're not healthy and you're uncomfortable and you're dealing with problems and you just feel crappy. I would much rather pay now as I go through life, eat healthy, take the supplements, and enjoy my life than eat crappy and have to take all kinds of drugs and then have more blood work and have arthritis and have surgeries and all of that stuff. Take care of yourself, right? Human or animal. And the supplements are huge.
As you're talking, I remembered one incident with a dog lover. Her name is Vicky. She lives in Maui. She's got a beautiful dog and she's a lovely lady. And I ran into her and she was, she usually hikes uphill and she was complaining about joints. And, you probably find people complaining about their joints all the time. Mm-hmm. So I asked my team to send me like a whole bunch of supplements, and I just give a couple of bottles here and there and just kind of say, try it, see how, I'd like to know. I talked to Vicky and I said, Vicky, I'm very happy to give you a couple of bottles. You can try it. And she goes, well, I'm really tempted, but what if it works? And then I'll have to spend money on it. I go, oh, that's crazy. So people buy all sorts of different junk and so on, and then they cheap out on themselves, or they cheap out on their dog because they are, they need to buy the next big screen TV or iPhone 17 instead of 16. And I go like, it just drives me crazy. And you and I I know that you love your job.
For sure.
Do you plan to retire, by the way?
The day before I die.
This is perfect. I'm retiring on the day I'm dying. Or if dementia strikes. But I'm taking Omega, so hopefully not anytime soon. But, I think that we have our priorities a little messed up. But I know that people who are listening and watching here, most likely not, because you guys are here because you love Dr. Laurie. And I really appreciate you, Laurie, and I love you. I hope I can say that. And we love dogs and we love making a difference and just kind of hearing the stories, right? Like hearing people saying, hey, my dog couldn't move and now he can move. Like I've been on both sides, right? And I'm so grateful to you. And at the same time, I'm also grateful for the knowledge that the universe delivered to my brain and to my life and work. So yeah, it's been just a great journey.
Yeah, absolutely. Absolutely. And I'm sure everybody who's listening loves your products. And as the scientist in me, I have to say how much I love that you have the good quality ingredients in them. balanced at appropriate
Thank you.
amounts.
Thank you.
So that's,
Thank you.
I
You
have to
know, we
call
do
that
our
out.
best. We package them in glass and ship them without plastic. Try to really walk the talk and recommend only what we would use and do ourselves. I think that is a principle. If you have a pet food company manager or someone who works within or formulator, and they don't feed the food that they formulate, there may be a problem, right? And so
Right.
I hope that there's many more times. Like I almost feel like we should make this semi-regular because there's always so much to talk about. Thank you so much about more info about tuning forks and fascia
Yes.
work. Can you please tell everyone where to find your courses, where to find your website and all that? And we'll also put it in the description here.
Awesome. Yes, it's OptimumPetVitality.com. And I named it that because I don't want just good for my pets. I want them to be optimum in health and everything. So OptimumPetVitality.com. And we have the Core and More course. We have the laser course for pet parents, which is at-home laser therapy so that they can learn to treat their patients at home like you do with PACs. And then
Highly
we have,
recommend it. All the courses and everything. It's just like, yeah, it's full of wisdom and information that is really useful. And also, it will save you guys on veterinary care and extend your dog's life for many
Yeah.
more summers to come, I hope. Yeah.
yes. And we
So
have
thank you.
fascinating fascia, which has all kinds of fascial techniques. And then we have tuning into your dog, which is all about the tuning forks. And if you're
Great.
in the
Thank you so
continental
much.
US, sorry for the people who are in Canada, but you're in the continental US, if you purchase the Tuning Into Your Dog course, you get a free tuning fork with the amethyst tip, as well as how to use it.
Amazing, amazing deal. And maybe
Well,
Canadians, you can also ship it to the United States. If you're living nearby the border, which 90% of Canadians do, we sometimes go across the border and we have it, we kind of pick it up too. So you can
yeah,
order it in the US
absolutely.
and have it shipped in the US. That would be fun. Cool.
Yeah, and just like you talked about with the supplements, the reason I did that is because I didn't want to have somebody buy a tuning fork from China where it's not
Yes.
the right metal, it's not the
Yes.
right frequency, and it not work and then think, oh, Laurie taught me wrong. So
Yeah.
I wanted them to get something really high quality, like I said, with the amethyst tip so that they can get in there and have great results right away.
I'll be getting one from me for sure. Because
Yeah, if you have
this
an
one is
address
free,
in the
but it's
US,
not the right
absolutely.
frequency. Yeah, yeah. I'll get in touch with you.
Excellent.
Thank you so much for being here today. Thank you everyone for watching. Give your dog a hug for us and we'll be back for sure. Take care.
Absolutely. Thanks for having me.
Thank you.